All right, Deja, thank you. And there is a possible breakthrough in the fight against the COVID-19 pandemic. The FDA granting emergency use authorization for a saliva test. Officials say results for this test can be determined in under 3 hours, and tests are expected to cost about $10 per sample. So this morning, we want to know more about the accuracy of these tests.
As always on Tuesday mornings, Dr. Dana Hawkinson joins us live from the KU Health System. Doctor, good morning. This new test is exciting. It's easy. It's cheap, potentially. Same time, though, the FDA just issued an alert to doctors and lab techs about a different, widely used test for possible false results. How do we know about the accuracy of saliva tests? We've talked about this with you before because of the difference between this test and the nose test.
Right.
How do you feel about these saliva tests right now?
Yeah, so I think we have to understand that these saliva tests are basically the same type of technology as the NP or the nasopharyngeal swab test, which is the gold standard, and that's the PCR test. It's a molecular test. So we're looking for genetic fragments of the virus itself. It's just a different sample. We hope that with the saliva test, it's just going to be easier for people to get, obviously, as most of the time they are just going to spit into a cup rather than have the nasopharyngeal swab swabbed into the back of their nose. So that will be easy to get. And early on, we also saw EUAs from the FDA, which sent out the ability for labs to do their own tests. We saw that some of those tests were not as accurate either. This is just part of that same step. It's just for the saliva test itself. Overall, from the numbers that I know, is that there is pretty good concordance with the NP swab test, the NP PCR, and the saliva. So it tends to be 96 to 100% the same results as the nasopharyngeal swab. Overall, it looks pretty similar, but again, you have to get into the exact companies and which tests are being run and made by those companies. You have to get really specific into just, rather than just saying, well, the saliva test doesn't work. This one that you are talking about was related to that specific company and their test itself.
And all those other things, Doctor, that's true. So let's talk about colleges now. Students in our area heading back to class, but at the same time, learning of at least 3 universities dealing with coronavirus outbreaks. The University of North Carolina just switched back to all online classes because of several outbreaks, and they just went to in-person class about a week ago. Closer to home, students are moving into campus housing at KU. They will be tested all semester long. They're trying several things to keep kids safe, but college, normally a time to, meet new people. Maybe you're going off and you don't know anybody there. You're going to be living potentially with a stranger in a dorm, new people in class. How, especially from a parent, how do I tell my student to stay safe from COVID-19 if they're in that kind of environment?
Yeah, that's a great question. We have worked closely with the University of Kansas Lawrence campus with Dr. Gerard and the Watkins Health and Lawrence Memorial to really try to create the safest environment possible. We have screened the students as they are coming in. It's been about a 1% positivity rate, which is a very good rate. Unfortunately, as you talked about, well, what are your bubbles? We understand that people of that age, and as we are seeing people even older in the 20s to 40s, but people of that age tend to want to congregate together and be in gatherings, parties, bars, things of that nature. They continue to get together, and when you do that, and when you are meeting in groups who aren't in your bubble, and obviously larger than 10, you are going to have the chance to spread that disease like wildfire and have increased cases, and that's what we've seen with UNC. It just takes an overall individual commitment and a group commitment to be able to do the right things, and that is stay in your bubble, stay away from large groups and large gatherings. And so far what we've seen is that has been very difficult for this age and even ages older than that to maintain and do that. And that is one of the reasons, one of the points as to why this infection continues to spread.
Doctor, for months now we've talked about, gosh, I hope we're going to have a football season. Gosh, I hope we're going to have a football season. We're finally there, just a few weeks away from the home opener. And big news from the team yesterday from the Chiefs announcing they're going to have Arrowhead at 22% capacity. That may sound small, but that's still 16,000 plus people all in the stadium at one time. I got to ask you, would you feel comfortable going to a game if it were to be tomorrow or in 3 weeks? Would you feel comfortable? And what would have to change between now and kickoff for you to feel comfortable going to a game with that many people?
Yeah. You know, you have to understand when we do our shows and we give our medical advice, we are really trying to promote the actual optimal medical advice and public health advice as to what to do. And really, to stop this disease, it has to be everybody quarantining and isolating and shutting down for 2, 4, 6 weeks. Is that reality? Not necessarily. But when you have that amount of people in that large of a group, even though the NFL and the Chiefs have worked diligently to figure out the best way to go about it and the safest way for their players, for their employees, and especially for the fans to do that, that's still a very risky proposition. Although you are outdoors, sometimes people in those situations don't necessarily maintain what they are supposed to be doing, the distancing, even though the Chiefs will be enforcing all of their rules. They have a very good plan in place. Will it be actually followed by the fans when you do have that volume of people, just as you stated? It's hard to say. I probably would still sit home right now and watch it from the comfort of my own home. But I know that they have worked hard to develop the safest plan possible, if you can talk about that with 16,000 plus people being in that area. You know, we are all trying to get through coronavirus, but right now it is still here. And I think talking about it right now and then talking about it in 3 or 4 weeks is going to be something completely different. So we have to wait and see what happens during that time.
Are you anticipating it's going to spread more than it is right now?
I think if we look back on the last 4 to 5 weeks or 6 weeks when we started talking about schools opening and what we have seen about the spread of the disease, that is what I'm anticipating. If every individual continues or starts to do the right thing, and that is not meet in large groups, wear masks everywhere, there is a chance we could flatten the curve or even decrease our daily new cases, and that's really what we want.
Dr. Hawkinson, thank you for joining us this morning. We'll see you on Thursday.
Yep.
So be sure to tune in this Thursday on 41 Action News Today. Dr. Hawkinson will join us live again to answer more questions. And if you're watching this and going, yeah, I wonder about this, send us your questions. We love to see those, and we will ask Dr. Hawkinson, and he's answering these live twice a week on 41 Action News.